Hi, so we'll be continuing with our topic about basics in liver. As my last video was basically to justify what exactly constitutes a liver and what is a normal physiological function of a liver. So today I'll be covering two topics about a disease in the liver. One is fatty liver and the second is hepatitis B. Though I would agree that both the topics are pretty huge and pretty vast and they require individual attention. But the whole idea of this premise is to have a basic idea of what exactly is a fatty liver and what exactly do you mean by somebody if he has hepatitis B. So starting with fatty liver, the most common scenario when any one of us goes to a sonographist, ultrasonography for some abdominal pathology, whether it is a basic health checkup or there is suspicion of some abdominal pain, or we are suspicious there is stone inside the kidneys or anywhere else, or a pregnancy checkup or anything of that sort, the most common report in the sonography would be about a fatty liver. When we ask our general practitioner what exactly is fatty liver, more often than not that topic is brushed under the carpet, there is no need to address it. But this definitely is not normal to have a fatty liver. But I do agree, not everybody who has a fatty liver has a disease. Not to mean to confuse you, I will go into details of it. So everybody who has a fatty liver does not have a disease, but a few individuals out of those who have fatty liver may progress into something called as a non-alcoholic fatty liver disease, and further out of few will progress into cirrhosis of liver or chronic liver disease. So this is a myth that only alcohol causes liver disease. I have got individuals, and obviously it is very common to have individuals to have liver disease and they have not even thought about alcohol, forget about drinking. This is very common in people who are obese, overweight, have a lot of truncal obesity, lot of fat around the liver, and obviously have been reported as to have fatty liver for many weeks or months together. So India, probably by WHO criteria, India would be the world capital in non-alcoholic fatty liver disease by the year 2025. Not really a very great distinction to have, but definitely can be preventable, definitely can be treatable. So if I can say, fatty liver is one of the most important or probably the first step in all chronic pathologies that affect the liver. Let us assume somebody is drinking alcohol beyond a certain limit. The first pathological change inside the liver would be a fatty liver. Similarly, if there is certain virus injury to the liver, which is a chronic virus, then the first individual injury to the liver would be a fatty liver. And obviously, if the injury keeps on persisting, the fatty liver will keep on worsening into non-alcoholic fatty liver disease or non-alcoholic steatohepatitis, and finally into chronic liver disease and liver cirrhosis, or it may lead to liver cancers also. So not all fatty livers have to be brushed under the carpet. Most commonly, the most important thing which we need to do is to prioritize who requires further evaluation. So somebody, as I mentioned, who will be obese, somebody who has diabetes, somebody who has a family history of diabetes, somebody who has cholesterol issues, somebody who has other liver ailments apart from fatty liver like a virus infestation or has significant ethanol alcohol intake also, will also need to be evaluated which stage he or she fits into, and then we need to cater to the therapy what he or she would require at that point of time. First thing is to remove the etiology, as in if it is certain drugs or if it is because of alcohol or some virus, then when we remove the cause, the chance of recovery from the liver injury are manifold. And apart from removing the cause, we need to keep it under check for a long period of time. Most important advice for a fatty liver obviously is diet and weight loss. So not many individuals would require some treatment for fatty liver. Most of the times, if it is a good check in diet control and good physical activity, most of the times it does not require any medicines. But there are few individuals who, in spite of diet and weight loss, do not have the liver in check. Here, after ruling out other possibilities of a liver disease, what we do is we start them on specific therapy pertaining to the particular disease which they have been treated. So definitely next time, if we are going for health checkup or something like that and you have a sonography which says fatty liver, please don't brush under the carpet, and they would definitely require at least a basic workup. You may not require medications, but definitely a basic workup to know whether the liver is getting infected or not, and we have to find out how things are from there. Next topic, obviously the time constraints, about hepatitis B. Definitely two different diseases. One is more of obesity and weight related disease, and hepatitis B is basically a virus. So why do I have to discuss about a virus now? Already the world is worried about a certain virus which has led to a lot of lockdown and things like that. But no, hepatitis B virus unfortunately has been there for n number of years, and unfortunately the knowledge which we have about a certain virus which is pandemic now, not many individuals do have that kind of knowledge about hepatitis B. Hepatitis B is a virus which primarily affects the liver and in the long run causes diseases like chronic liver disease and cirrhosis of liver along with hepatocellular carcinoma, cancer of the liver. It spreads by three routes. One is from mother to child. Second is when there is a physical relationship between two individuals. And third, when a person infected with hepatitis B uses a particular needle and some other person uses the same needle, or by certain blood products they are transfused in that. Apart from that, if you are eating from the same plate or probably wearing the same set of clothes, living the same house or drinking a glass of water, hepatitis B does not spread like. These are the only three ways of transmission by which hepatitis B spreads. Sounds very familiar. I think most of us know that hepatitis B transmission is as similar to the HIV transmission, which is by individual, by mother to child, physical relationship and by use of infected needles. So what is the difference between it? The rate of transmission of hepatitis B is 30% and the rate of transmission of HIV is only 0.3%. Not to demean anything, they both are equally dangerous, and I would pray that nobody gets the disease. But the point is that probably the rate of transmission in HIV is very low as compared to the rate of transmission in a hepatitis B virus, which is 30% and 0.3% in case of HIV. Even the other virus, hepatitis C virus, the rate of transmission is 6%, which is obviously more than HIV. But obviously we know quite a few healthy practices to prevent all this by use of barrier methods of contraception. The needles are used which is being disposed and everybody uses a fresh needle. The blades that we use in a saloon and stuff like that. And obviously individual health practice. Most common scenario where we get a person with hepatitis B when they go for visa interview or they go for some minor surgery, say cataract, or maybe young guys who have a fall from bike and they have a fracture and they go to the hospital, they find out that hepatitis B is positive. And once we check the entire family, we find out that most of the individuals in the family have hepatitis B, and out of them, few would also have chronic liver disease, but they never had any symptoms and they never tested for it and they never knew that the liver in the background is taking a toll and getting worried or getting injured. So most common scenario when we find out of individual with hepatitis B, first thing we do is to check the entire family whether they have any hepatitis B virus positive. Simple blood test done very commonly in any of the labs near your house. So we test for the individual's parents, spouse and the siblings. And if any one of us is positive, obviously we test his siblings and his spouse in that manner. Depending on who has a hepatitis B, in what age group it presents depends on the type of pattern, whether hepatitis B is going to remain chronic or it is going to be cleared on its own. The body has a natural tendency to clear the hepatitis B virus, but not in everybody. If the hepatitis B virus is attained in a very young age, the 95% chance that the body is not going to clear the virus and the virus is going to stay in the liver for many years and probably it's going to damage the liver also. But probably if the virus is attained in a younger age, maybe say in teenage or something like that, then 90% of the times the body will clear the virus on its own without any treatment. So we need to find out what age exactly it is current and what is the current status of the liver injury the virus has caused. And depending on that, we can offer treatment to control the virus. As of now, there are no such medicines to cure the virus, not in any of the specialties or subspecialties that I know of. Hopefully, in the near future, we would be looking at a cure rather than control the virus. But till then, the most basic premise is for safety health practices, regular screening, and whoever has had a negative hepatitis B, taking 3 doses of hepatitis B vaccination. Most of the times after the 3 doses, the virus is very well under check and the individual is almost free of getting the virus from any other individual. There are no requirement of booster doses in this race except for special population which include patients on dialysis and probably healthcare workers. There is no recommendation for booster dose. 3 doses of vaccination and there is a safety from a virus which is much easier transmitted than the other deadly viruses for sure. So I would stop here and just to summarize about 2 basic health topics in the liver. Fatty liver does not have to be brushed under the carpet. Diet and exercise is the main treatment and individual therapy depends on the level of injury to the liver. Secondly, risk factors would be obesity, diabetes, hypertension, cholesterol issues and family history where there is diabetes and cholesterol. And obviously treatment will depend on what stage of liver injury or is there any liver injury or not. And in cases of hepatitis B, again family screening is most important. Which stage of liver injury it is most important, and vaccination of individuals immediately when you share a common house and obviously you have a physical relationship and with is the most important aspect to prevent the spread. So as per policy as adopted by the Indian government, it is almost a decade where the vaccination is compulsory for individuals born on day of birth. So along with polio virus, BCG virus, hepatitis B is compulsory. But still not many individuals, not many children are not covered because India is a vast country and the geographic area. So if thankfully at least there is a first step in clearing the virus from the newer population. For the older generation obviously checking, and if it is negative we can always take a vaccine from there, and if it is positive, what is the stage of liver injury if there is any, it depends whether the treatment is required or not. Thank you so much.